Welcome back to Metta Health Talk. Today we are discussing a diagnosis that strikes terror into the hearts of parents and oncologists alike. We are talking about alveolar rhabdomyosarcoma, ARMS, ARMS. If embryonal rhabdomyosarcoma is a common version of this muscle cancer, alveolar is the aggressive cousin. It grows faster, spreads sooner, and recedes 3 months later. It's a cancer of the skeletal muscle, the very tissue that allows us to move. But instead of building strength, these cells build tumors. Today, we will break down the genetics, specifically the chromosomal translocation that acts as the engine of this cancer. We will look at the treatment, why we have to use chemotherapy, radiation and surgery. And finally, we will tell the story of Ofelia Torres, a teenager whose battle with this disease became a national symbol of the conflict between healthcare and immigration policy. First, let's decode the name. Why is it called alveolar? It has nothing to do with the lungs. One pathologist looked at these tumor cells under the microscope in the 19th century. They saw something strange. The cancer cells were round and blue, and they arranged themselves in hollow spaces separated by thin bands of tissue. To the doctors, this looked exactly like the alveoline essence of the lungs, hence the name alveolar rhabdomyosarcoma. The reality, these are primitive muscle cells, rhabdomyoblasts, that have forgotten how to become muscle. Instead of fusing together to form long, strong fibers, they float freely in these little nests, multiply uncontrollably. This floating nature is partly why they detach and separate, metastasize so easily to the bone marrow and lymph nodes. What causes ARMS? Unlike many adult cancers, it is usually not caused by lifestyle and smoking. It's a genetic accident. Specifically, a chromosomal translocation. Imagine 2 books, Book 2 and Book 13. By accident, a page is ripped out of Book 2 and taped into Book 13. In 70% of ARMS cases, pieces of chromosome 2 and chromosome 13 swap places. This fuses 2 genes together, PEX3 from CHR2 and FOXO1 from CHR13. The result, the new fusion gene PEX3 FOXO1 creates a mutant protein. Normally, PEX3 helps muscle cells grow in embryos and then turns off. But when fused with FOXO1, it creates a protein that is always on. It acts like a gas pedal welded to the floor. It tells the cell, divide, survive, never die. This is why ARMS is so aggressive. It is driven by a broken engine that cannot stop reviving. How does it look in a patient? Unlike embryonal RMS, which left the head, neck, and bladder of young children, alveolar RMS prefers 1. Older children and teens. It strikes adolescents more often. 2. Extremities. It left the deep muscles of the arms and leg. 3. Trunk, chest and abdomen. The symptoms. It often starts as a deep, firm, painless lump because it is deep in the muscle, like the thigh or forearm. It can grow quite large before it is noticed. Parents often think it is a sports injury. Oh, he got kicked in soccer practice. But the bruise doesn't go away. The lump gets bigger. By the time it is diagnosed, because of that PEX3 FOXO1 engine, it has often already spread to the lungs or bone marrow. This makes it a stage 4 diagnosis right from the start. Treating ARMS is a war. We cannot be gentle. Because the cancer is systemic, likely microscopic cells everywhere, we use the multimodal approach. 1. Chemotherapy. This is the backbone. We use a cocktail called BAC, vincristine, actinomycin D, cyclophosphamide. We hit the whole body to kill floating cells. 2. Surgery. We try to cut off the main tumor, but because it grows deep in muscle, getting clean margins, removing it all, it difficult without amputation the limb. 3. Radiation. Arms is very sensitive to radiation. We blessed the primary site to kill what the surgeon missed. Even with this aggressive Scorched earth protocol, the cure rates from metastatic arms are challenging, often less than 30 to 50%. This brings up to the human reality of this battle. Treatment takes months, sometimes years. It requires stability, money, and constant family support, which leads us to the story of Ofelia Torres. Ofelia Torres was a 16-year-old high school junior in Chicago. Like many teens with arms, her diagnosis became suddenly. One day she was a normal student. The next, she was fighting stage 4 Alveolar Rhabdomyosarcoma. She was in the middle of that grueling treatment we just described. Chemo, radiation, constant hospital visits. Her body was fighting the fusion gene, but she was also fighting another war. In October 2025, while Ofelia was battling for her life, her father, Ruben Torres Maldonado, was detained by ICE, Immigration and Customs Enforcement agents outside a Home Depot. Ruben was the sole provider. He was the one who drove her to chemotherapy. He was her emotional anchor. Suddenly, Ofelia was not just a cancer patient. She became a campaigner. Stress is poison to a body fighting cancer. Ofelia, from a hospital bed and wheelchair, recorded videos pleading for her father's release. She said, "My dad is a hard-working person who wakes up early. I find it so unfair that hard-working immigrant families are being targeted." While her white blood cells were trying to recover from chemotherapy, her mind was consumed with the fear of her father being deported. The community rallied. The judge eventually granted her father cancellation of removal based on the hardship his deportation would cause his U.S. citizen children. He was released on bond, but for Ofelia, time ran out. On a Friday in February 2026, Ofelia Torres passed away. She died a hero, having saved her father's residency status. But the tragedy remains. How much energy did she have to divert from healing to fighting for her family's unity? To conclude, Alveolar Rhabdomyosarcoma is a biological beast. It is driven by the PAX3-OXO1 fusion, making it one of the hardest childhood cancers to cure. But medicine doesn't happen in vacuum. The story of Ofelia Torres teaches us that psychosocial support is just as vital as chemotherapy. We cannot effectively treat a child tumor if you are simultaneously dismantling their support system. Ofelia's legacy is not just her battle with arms, but her reminder that parents are people, embedded in families, fighting for their lives on multiple fronts. Thank you for joining this masterclass on Metta Health Talk. If Ofelia's story moved you, please share this video to raise awareness for both pediatric sarcoma and the humanitarian needs of parents. Rest in power, Ofelia.